All right, so we have protozoal infections. I've been through the ones that we have effective treatments. Typically either they're labeled approved treatments or there's a good bit of evidence to support their use. This next group, we think we help, we have treatments, but the evidence is not as large as with the prior group. So I'll talk about each of these particular diseases. Canine hepatozoonosis due to hepatozoon americanum. There's a less reported hepatozoon canis is transmitted through the tick in the life cycle, and it produces a pretty severe pyogranulomatous myositis. Now, you won't know about the pyogranulomatous unless you do histopath, but what I can tell you is the signs: they're stiff, they're lame, but they're really hyperesthetic. Now, this is the classic, there are always exceptions, but if you actually press on muscle masses on the dog, they will wince. They're painful to the touch. All right, and that's because basically you've just got all of the muscle inflamed. And it's a marked neutrophilia when they have this. And by marked neutrophilia, I'm not talking 18, 20,000 white cell count. I'm talking 50, 60, 80,000 white cells very often. And there are not a whole lot of diseases that create that severe a leukemoid response. Pyometra in the bitch, immune-mediated hemolytic anemia, diffuse peritonitis, those sorts of things. But anytime you get a dog with a ultra high white cell count and you can't find one of the more normal explanations for it, consider hepatozoonosis as a possibility. Now, for the longest time we had to do muscle biopsies to definitively diagnose it. Now we do have PCR that greatly simplifies things. And we have a 3 medication treatment. So these dogs, once they're diagnosed, they get clindamycin, a potentiated sulfa, TMS, and pyrimethamine. Now, part of the reason I included this in the list of diseases we don't have a lot of evidence is because we don't really know if all of these drugs are necessary. Especially when you look at potentiated sulfa and pyrimethamine, that overlaps a lot. I suspect pyrimethamine is probably more important than TMS in this regard. But no one's really taken the time or they're willing to take the risk of only doing a 2-way combo, say, and there have been no studies. So we don't know if all of these 3 are necessary. We just do it because it's worked in the past and no one's willing to take the chance of not including them. Okay, so that's kind of why I put it in here. The good part is they typically do respond to the 3-way treatment. So that's a good thing. But they usually will not clear. They'll go into remission. And that's where the decoquinate, the decox, comes in. Here's another place where we're using decox. And it's really common to put these dogs on lifelong decox after we get them into remission. So we'll put them into remission with a 3 antibiotic regime, and then we'll put them on lifelong decox. If you don't, there's a pretty high probability they'll relapse, and then you have to go through the whole scenario again. So this may be a lifelong treatment for the dog. Now, the good thing is the decox, because it's a feed additive or medication for large animals, it's pretty cheap to use. It's not a big expense. It's just the hassle of getting it compounded into capsules and everything, because again, it is a feed additive or top dressing, that sort of thing. Imidacloprid will treat the canis form, but easily, I would say 99% of the time, once we have a diagnosis of hepatozoon, we use the 3 antibiotic antiprotozoal regime and follow with decox. So once you make the diagnosis, this is not bad therapy. All right. Neospora is quite similar to toxoplasmosis is an issue in dogs and cattle. Cattle primarily is abortion, okay? But dogs get signs very similar to toxo, predominating in the CNS and muscular signs. And one of the tip-offs on this is that they get very rigid rear legs, okay? So not a paralysis, but the opposite, very stiff, rigid rear legs. Anytime you see that in a dog, Neospora should come to mind. It's very closely related to toxoplasmosis, so it's basically the same treatments, largely clindamycin we're talking about. Pyrimethamine sulfa would be an alternative. It's got a guarded prognosis though, because by the time we diagnose the disease and start treatment, oftentimes there's been a good bit of damage done to the spinal cord. So the earlier you can get to them, the better, but somewhat guarded in their prognosis. And it's not something I deal with, but cattle, of course, there's a vaccine for Neospora to try to prevent the abortion aspects. All right, so we treat it, but the prognosis is not good. All right. Here's one that I've mentioned several times to you before. Cryptosporidia, again, zoonotic, often associated with contaminated drinking water in humans. There was a massive outbreak of Cryptosporidia in humans in Minneapolis several years back, where they draw their water supply. I can't remember which Great Lake it's from, but anyway, the intake water supply got contaminated with crypto, and not many disinfectants kill Cryptosporidia, and there were hundreds and hundreds of people coming down with crypto. And it's a pretty severe diarrhea, primarily small bowel, usually self-limiting. They feel miserable, pretty bad diarrhea, but in the immunocompetent individual, they usually, it'll run its course. Not so in the immunosuppressed individual. Now, I've already addressed these first two, peronomycin, aminoglycoside. It works, but because of devitalized intestine, not devitalized, but damaged intestine, we think it may be absorbed and you're at risk of nephrotoxicity. Azithromycin has been kind of our standby instead. And this is one I was really unfamiliar with. I mentioned it earlier because there was a paper about its benefit and well tolerated in dogs for Giardia. But the difference is this is the only approved drug in humans to treat Cryptosporidia. And in the paper on Giardia, they noted that there seemed to be a benefit with crypto as well. So I would say no one's using peronomycin anymore. Most people use azithromycin, but it'll be interesting to see if they don't use the Alinea instead. I'm sure it'll be a cost issue as to whether they do it. And we don't know how azithro and Alinea compare, but it may very well become our drug of choice in treating Cryptosporidia. Again, the thing that I'm still waiting to hear is whether or not treatment significantly decreases the duration of the clinical signs or the severity. My presumption is it does, but in animals we don't really have the data. All right, here's one that I have never seen. Usually most of these things I've treated. This one I have not. Leishmania occurs in humans, but also in dogs and cats, and there are two forms. There's a cutaneous form, which you see up here, these ulcerated nodular lesions. But there's also a visceral form, which is more life-threatening. So far, or the original outbreak of leishmaniasis was in a group of foxhounds in New York, but when they've done serology, they have documented that it's occurred in other areas of the country based on antibody titers. So it's out there and the animals are being exposed to it. So you have these cutaneous forms, and as I say, the more lethal visceral form. diagnosed off bone marrow and lymph node aspirates, and there is a PCR for it. The sandfly is the vector. You have to have sandflies in the environment for its transmission. Now, there are a lot of treatments for it. These down here have all been tried. They're in gray because you don't have to know those. Pentamidine is one that's used in humans. It's approved to treat pneumocystis pneumonia in humans. Again, pneumocystis pneumonia is primarily a disease in the immunosuppressed human, particularly the AIDS human. But it's been used more commonly in vet med. We'll use allopurinol. And this is kind of odd. We don't think of allopurinol as an anti-infective. Your major use of allopurinol is actually in Dalmatians that have problems with urate stones. The mechanism is there, but basically it blocks xanthine oxidase and therefore decreases urate stone formation. But that same action happens to interfere with the metabolic processes of the leishmania, and although it requires long-term treatment, i.e. 2 years, it is somewhat responsive. I found an article that looked at furazolidone and domperidone, which seemed effective at least in the cutaneous form. The furazolidone, again, a nitrofuran, as I said, you should see a pattern where the nitrofurans usually are never your first drug of choice, but they have a lot of backup in terms of what they're effective for. The domperidone we'll talk about in a subsequent section. It's used for 2 things. In humans, and it's an antidopaminergic drug. For humans, it's used as an antiemetic. It's about the only peripherally acting antiemetic that works. We'll talk about GI drugs later. But here it's approved in the U.S. For treating fescue agalactia in mares. Fescue pasture, if they have the fungus endophyte, that can cause agalactia where the mares don't produce milk. We give them domperidone as an antidopaminergic. That leads to an increase in prolactin, and then we can get them to come into milk that way. But here it's being used actually as an immunostimulant, and it showed some benefit, but mostly I want you to know allopurinol when it comes to leishmaniasis. And again, I'm not going to hold you responsible for these, but in Europe they have some antimony-based compounds that are probably the best at treating leishmaniasis, but they're not in the U.S. At this particular point. Okay, and the last disease that we can treat is feline cytozoon. And this is a protozoal infection of cats. They think the bobcat is probably the reservoir, but it affects our domestic cats. And it is a severe, severe, life-threatening disease in kitty cats. They initially tried the 2 drugs here, imidacarb and dimenazine. Not a lot of difference in success there versus control cases. About 20% survive, perhaps a little less. Then they tried atovaquone and azithromycin, and they had much better success. Now, 60% is still not great, but it's a lot better than 20%. So this is kind of our standard treatment. So, you know, go through and look. I've mentioned several times atovaquone and azithromycin. So know what various diseases this combination will treat. Okay. We actually had our first surviving cat for hepatozone a couple of months ago. Probably because it was diagnosed really early. This was a cat that was owned by a lady, and her prior cat had died of cytoxazone. And when the second cat later, and it had been a while, came down with clinical signs, she immediately brought it in and wanted it checked to see. So that cat did survive. it is a fairly painful disease, and good pain control is a part of this, as well as the actual anti-infective therapy. And remember, cats don't show pain the same way dogs do. Cats tend to hunker down and ball up, and so it's harder to assess. But you need some sort of analgesic when you're treating these, as well as the anti-infective and other supportive therapies. Okay, and then lastly, we have certain diseases that we just basically can't treat in the protozoal line. Chagas disease, trypanosomiasis, it's a human disease that is a huge problem in Central and South America, but it also will affect at least dogs, and I believe cats as well, but at least dogs, okay? It's carried by the kissing bug, requires a kissing bug bite. Now, it's not my area of expertise, but from what I've read, the kissing bug in most of the U.S. is not the strain that carries Chagas disease. However, there have been cases on the border states with Mexico where humans and dogs have come down with Chagas disease, so it is moving north. So if you're practicing in the border states, bear this in mind. What it does, the parasite attacks heart muscle. It's fairly specific and has a prolonged incubation period, months to years after actual infection. And there is no great treatment for it. Now, because of that, in human medicine, the CDC can make arrangements for a physician to get these two drugs that you don't need to know about. You just need to know that they can get special permission to use these kind of on a compassionate need basis. Oftentimes the disease is so far advanced, though, that they require a heart transplant. The heart is so damaged by the time it's diagnosed that they often require a heart transplant. Needless to say, there is no treatment in veterinary medicine. I don't know if you could get these drugs or not, since it's for human use through CDC, or if you could afford them. So largely we have no treatment for Chagas disease that I'm aware of in veterinary medicine. Now, trichomoniasis is a venereal disease of cattle. You can correct me. You probably know better than I do if you've had therio diseases. That may be next semester, I presume. But my recollection is that the cows will may abort, etc., but they often cure the disease with time. The bulls, however, you cannot cure them, so they're persistently infected and basically have to be culled from the herd. This is the one I mentioned where people were using imidazoles related to metronidazole to try to cure the bulls. And that use was subsequently banned because of it being a carcinogen. Now, the fallout from that use, so we can't treat trich in bulls once they have it, their vaccines. Histomoniasis is related. Histomoniasis is, in turkeys is called blackhead disease. And we had ipronitazole, and which is again imidazole related to metronidazole, that was approved to treat turkeys. I don't know whether it was the fact that it's a carcinogen that they pulled it, or whether it was being used extra labelly so much in bulls, but for whatever reason the FDA had it withdrawn. So then the only thing left was nitarsone, which is an organic arsenical. So it's an organic molecule with arsenic in it. It wouldn't cure the disease, but it was helpful in controlling it. But then the FDA got concerned about residual arsenic. There was some data to suggest the organic arsenical was leaving inorganic arsenic as a residue and not causing overt arsenic poisoning in the turkeys or anything, but they got concerned about human food safety from inorganic arsenic residues. So it's been withdrawn as well. So that leaves us with nothing to treat histaminiasis. Now, histaminiasis is in some way related to cecal worm infestation in turkeys. So most of the emphasis now in turkey flocks is good deworming protocols to control the cecal worm, since we don't really have active treatments for histaminiasis in turkeys anymore.